Hello, my name is Teresa Stephenson with the Department of Mental Health and Substance Use Services. I'm the Director of Medication Assisted Treatment, as well as Stimulant Use Disorder and Women and Family Specific Treatment Services. I'm here to share with you programs and resources that we have available for those different types of disorders and programs for family and children. And first, we'll start off just by, again, introducing myself. That's my contact information, and you may contact me at any point in time with questions or concerns or thoughts. So here's a large list of some of the things that I oversee. I'm not going to read all of those to you. I'm just sharing them with you so that you have an idea of what's going on in our state and the different arenas that this all plays into. Many facets of what happens in the state touches families and children. And we're serving a lot of the same families, so it's good to know where all of these things are going, if we're aligning, if we are collaborating. And so these are just some of the things that we work on and I'm a part of personally. I'm going to introduce some of my staff. They won't be presenting, but just so that you know who is over what program and put a face to a name, because we tend to not be able to see those individuals a lot of times. We're emailing or talking on the phone and never get to see each other. So I just wanted to give a little bit of a overview of what other programs we have available. And so this is Kim Kane. Of course, she's our senior project manager for the state opioid response and soon the state opioid stimulant grant that the federal government has provided to our state. This is Tanya Butler, and Mary Kate is one of our field staff, and Stephanie Gay is our state medication, it's not Medicaid, it's medication assisted and stimulant use treatment coordinator. And so basically Stephanie will work with all other agencies or programs in our state that receive federal funding for opioid use disorder. So a few of the programs that fall underneath our opioid grant, we are working to support some of the certifications for brand new recovery residences and also assisting with first time housing needs for individuals that can't afford rent for the first couple of months and those kinds of things. We have Oxford houses, and I've put links to almost every resource we have on this slide deck. And so if you want more information, further information, you can use any of those links, and hopefully you'll be able to get these slides so that you'll have them available to you. Housing First is another evidence-based housing program, and it doesn't require individuals to already be in recovery. We believe that some of the basic needs need to be met sometimes to help and assist in recovery. Other programs is our opioid treatment provider and our methadone clinics. There's a resource to map those that are close to you. All of these providers have telehealth capability, and so that makes it very useful, and especially in the rural areas where individuals have difficulty getting to and from for transportation. And even in our metro areas, sometimes our buses stop at a certain time that's not conducive for individuals to receive treatment. And so there are those options. Of course, we know there's barriers to that because some people don't have great internet service, or maybe they don't have a phone, or they have Go phones and burn phones that make it more difficult to reach individuals. But these are options that are available to people. And during the COVID crisis, an epidemic, it's actually improved treatment retention and treatment adherence for some people, and that's been very encouraging. We have medication assisted treatment providers, which are community mental health centers and certified addiction recovery centers in Oklahoma as of right now. That means that they have a comprehensive, holistic approach to treatment, as well as some of their health concerns. And that can all be serviced at these locations. So they have a prescriber for opioid use disorder on staff, or they contract with them. And so those are available also on the same website, or the website that'll be listed below on okamready.org. There's also some prevention components on the website, and all of the naloxone hubs. Naloxone is the life-saving component. If someone is overdosing, they can, if naloxone is administered to them, it can save their life. And so there are hubs in your community where you can get a free naloxone kit to keep with you at any point in time. And some people might say, well, I'm not around those people. I don't work with those people. I don't know anybody that does that. It doesn't matter, because it could happen in the community at any point in any time. And you might be seeing someone that is experiencing that, and you would have that available for them. We also have the Chest Health app, and I would encourage you to go to that website. We are working on a statewide plan for the Chest Health app. There's an e-provider recovery piece to it. There's a treatment component, and then there's a case management resource component. And it's very exciting. We have some pilot projects with our child welfare, or our Department of Human Services, which includes Adult Protective Services. And we have a project with the OU Health Science Center with their STARS clinic, and with some prenatal clinics. So, and we're very excited. I think we are now working with Norman Regional and Duncan Regional, and some other hospitals as well, to ensure that referrals get to and from individual, without prior just handing a number to someone. They can actually make that referral, get the consent on the application, and somebody can put it on their phone, and they get reminders. So it's a really, really interesting and wonderful application that we think can really be beneficial to ensuring people don't fall through the cracks, and that those services are available to them. As a church, even, you can become a partner with a hub that is in your community. So all community mental health centers and the certified addiction recovery centers will have access to this application, and they can invite you to be a referring partner. There's no cost to you to join or to be a partner. You just have to be invited, and then you sign a couple of pieces of paper, and you can be a potential referring partner, and they can refer to you as well if there's other needs. Again, Chest Health app. Kelly Earls is over our Family Treatment Court. And if you aren't familiar with Family Treatment Court, you may have heard of Adult Drug Court. It's similar in that you're dealing with individuals that have a substance use issue. However, Family Treatment Court is dealing with the deprived or child welfare. So it's not a criminal court. It's more of a family court that provides treatment services, substance use treatment services, and co-occurring services for individuals that have had their children, or their children are in out-of-home placement due to the parent's substance use. So they've had neglect or something of that nature, but the result of that came from or related to substance use. And so they can go through this very intensive program for those individuals that are really struggling. It provides a lot of additional supports. It's wraparound services. They do family-centered service planning, which is like really looking at the entire family. And they provide a lot of additional supports and accountability, not only for the individual, but for the court and child welfare workers and treatment providers. They work as a team to really help this person engage and to have their children return to their home earlier in the process than traditional child welfare cases. And this is just another one of our team members. It's Katie Hagan. She's the project manager of Family Treatment Court programs. And then Casey Rains is actually one of our coordinators in Oklahoma County that um, she actually works for the department for that particular uh, county. We don't have that across the board. Majority of those we contract with the county or another entity within the county to pay for the coordinator to provide that service. Marquisha is also another field service coordinator. She's with the family treatment courts as well. And you can email any of them to get more information. They have probably 7 to 9 grants going on at some point in time. Many are very focusing on 0 to 3, however, serving the entire family. But that is the highest group of individuals or children, babies, that are actually in out-of-home placement. So there's a lot of emphasis and work around that. Katie Fortune's no longer with us, but she was over our Quality Improvement Center for Collaborative Community Court Teams and also Family Treatment Court Model Standards Study. So she's no longer there, but we will have someone that will be replacing her, and those programs are still in existence. And here's just some updates and information. I won't go through all of these. This information is available to you if you request it or can get access to this PowerPoint. As you'll see, we have multiple counties. I'll go back. We have Okmulgee, Oklahoma County, Tulsa County, Cade County, and Custer-Washita County. So those are the counties that currently have family treatment courts. So if you're not familiar with plans of safe care, this would be a good time to get familiar with that, because you can be involved in the faith-based community to be a part of a plan of safe care potentially. So currently we have a policy academy that we were awarded to be a part of, that we will be attending next week to really address plans of safe care and what that looks like. And plans of safe care come from statute, from federal and state statute, to report any infant that is born with neonatal abstinence syndrome or fetal alcohol syndrome. And what happens is that those reports get reported to child welfare, and they will determine if there is a need to visit the parents to determine if their baby is safe. No matter whether the baby is safe or not, they are to create a plan of safe care and to follow that plan of safe care until, I guess, ongoing, until they feel everything is good. And there's been some things that haven't quite been really lined out, and it's not a child welfare issue, it's a state issue, it's our local community issue. And so we want to be a part of assisting in supporting these families. And so it's not completely left up to child welfare, which right now, currently, the way the statute is written, it is completely, totally up to child welfare to do all of this work, which seems daunting, but we want to support that. And so we've been working closely with them on that policy academy, as well as many other state agencies. We are also working on an in-depth technical assistance project that will be working with pregnant women with substance use issues and infants and children that have been exposed to substances. And it's a statewide initiative to really streamline and to look at pre-pregnancy, prenatal, birth, postnatal, and childhood. So there's a 5-point strategy to address this across the continuum of care, the continuum of the child and the parent's life, and to ensure that we are aligning and supporting these families at all aspects. Say the hospital, if they're involved in Department of Corrections, or if they are in child welfare, or some of these other programs that we might not think of. We want to be kind of saying the same things, encouraging the same things, and educating people in the same ways. And so we hope to have a uniform data platform, a uniform practice of, and policy as far as how women are treated for opioid use disorder or other substance use disorders in hospitals as well as treatment. This is Katie Harrison. She oversees our TANF, which is the uh, temporary assistance of needy families, and also the child welfare substance use treatment services. So if a child welfare, if a parent involved in child welfare has a substance use issue, the federal government has allowed TANF funds to be utilized to pay for those services. And so DHS contracts with the Department of Mental Health to subcontract these out and monitor these programs. And there's a lot of collaboration and work that goes into this program. This is Natalie Gibson, and she oversees our Oklahoma Pregnant and Postpartum Women Grant or Initiative. And so basically that just brings some evidence-based practices to the residential care facilities that have women and children at the residential care facility. And again, if you want more information on any of these programs, or you're welcome to contact these people individually, or you can contact me as well. So there's strengthening families and celebrating families, and that these are evidence-based practices we use. We do have some faith-based partnerships where they are supporting treatment providers or family treatment courts. We do require that as a part of the family treatment court. And we do have some faith-based communities that really support and help these programs to be able to operate and be successful. So it's been really wonderful to see those collaborations. Sean Couch, he's over the Substance Use Treatment Access to Recovery and Supports project that's located within the STAR Clinic at OU Health Science Center. That's a clinic that assists pregnant women that have a substance use disorder, and they provide not only the therapeutic services, but the OB services throughout the entirety of the woman's pregnancy. If they have an opioid use disorder, they are provided medication-assisted treatment through that program as well. And they're afforded telehealth, the Chess app. There's peer recovery supports. There's a lot of services and supports that are a part of that program, and there will be an evaluation piece to that, so we will be able to see the successes. I won't read all of these things to you. That basically just goes over the goals and objectives for that program. And if you'll notice that a lot of the collaborations have been with hospitals and emergency departments, first responders, a lot of areas that were non-traditional partners in the past have now become an integral part in what services we provide and what collaborations we have, and it's been a very wonderful experience. As far as the opioid epidemic, one of the benefits that's going to be occurring in October is that methadone will actually be Medicaid compensable for the first time ever for opioid use disorder. And so that will be wonderful for those individuals that haven't been able to afford or pay for those services for that program. I'm going to just briefly name the evidence-based practices. If you want to know more, because there's so many, just click on the link and it'll give you a little bit more information. These are some of the trauma EBPs. So if someone's experiencing trauma, and we know there's a huge linkage between substance use and trauma. And so it's good to ensure that we're addressing both at the same time. And without one, you're really going to exacerbate the other, I think. So it's been proven that you need to be working on both of these things. So cognitive processing therapy, eye movement desensitization and reprocessing, and seeking safety and TREM. Seeking safety and TREM are both group, can be group models, and then the other two, I believe, are individual. And we have early childhood and infant mental health and family treatment EBPs. And the reason why you even put these in there is because when you are treating a child because their parent has a substance use issue, you need to treat the entire family, not just the parent and or not just the child. So it's very important to ensure that the parent is learning good parenting skills, is learning to bond with the baby or the child. So there's circle of security, celebrating families, strengthening families, and child parent psychotherapy. There's different levels of providers that can provide these types of services. So it's best to go online and check those or contact one of our staff and they can let you know what level of service provider can provide those types of services. There's attachment and behavioral catch-up, parent-child interactive therapy, and family behavioral therapy. Infant massage, preschool TFCBT, wraparound, early childhood mental health consultation. So our state is providing that in different areas of the state. All of these EBPs that I'm listing are currently provided throughout our state. Not all of them are statewide, but they are provided throughout our state. And I'm sure the goal will be to make sure that those become statewide at some point in time. Early childhood and infant mental health is behind quite a bit. And so we are really working to enhance and support that work so that we can ensure that these services are available to all families in Oklahoma. We have the matrix model. Most of these will be for those individuals that have an opioid use disorder. They can be used for other substance use disorders, but they have been shown to be the most effective with opioid use disorder. The most effective is the community reinforcement approach coupled with contingency management. So we'll look at that in just a minute. But matrix model, contingency management, motivational interviewing, motivational enhancement therapy, adolescent and adult community reinforcement approach. And this is the approach I was talking about that is when coupled with contingency management has the best outcomes for individuals that have an opioid use disorder. There's cognitive behavioral therapy, individual placement support. So individuals that need additional support to function at work or at school can have this service available to them through many of our providers. And we are still highly encouraging all of our providers to adopt this service and practice it. I'm not going to read all of these, but these are all available. And they're not specific to opioid use disorder, but they are definitely available and useful. More evidence-based practices. I went through that already. I have double slides. So just so that you know that about the resources that we have available, resources available to individuals that may have or agencies that may need additional funding or supports for telehealth. There's a couple of resources here called the Heartland Telehealth Resource Center. And there's several vendors that have been helping. There's the telehealthresourcecenter.org website. And then we have the, again, Heartland Telehealth Alliance Oklahoma. American Telehealth Association. There were some service providers, internet service providers, and telephonic um, assistance, and you can look at these to see if these are still in existence. The FCC was the internet service. It was either reduced or no cost for during the epidemic. So if I'm not sure if that's still available, but definitely you could check that out. And then the Assist Wireless, I believe, was the cell phone um, assistance for individuals. So if they wanted to be able to do teletherapy or telephonic therapy or use the Chess app, they could potentially access a reduced or free phone through that. They do have to qualify to receive that assistance. And then our grant, those community mental health centers and certified addiction recovery centers that we spoke about earlier also have supports that can help someone that's in services with their agency on obtaining what they need to be able to get services there. And they could explain all of that if referred. So again, I'm with the Oklahoma Department of Mental Health and Substance Abuse Services, and here's our contact. And this website right here will get you to many of the programs, and there's additional programs that I didn't get to, such as adult drug court, veterans court. There's a lot of other programs that are available that may not be opioid specific. However, they are available on this website. Please let me know if you have any questions or concerns.